And good morning to you. Let's bring you this now. The COVID-19 lockdown has led to increased teen as well as other pregnancies and maternal deaths in East and Southern Africa. Well, this is according to the United Nations Population Fund. It has assessed the impact of a major reduction in the use of health services, this especially sexual and reproductive health as well as gender-based violence services. But to speak more on this, I'm now joined by the organization's regional humanitarian advisor, Dr. Ebele. Thank you so much for your time. Let's talk about how this particular, part of, services and healthcare services has been neglected. I'm talking here about, health and sexual reproductive healthcare services, particularly to young women.
Good morning, and thanks for hosting me this morning. So in terms of how the sexual and reproductive health services for young girls and women has been affected by the pandemic, you may want to look at it in two ways. There is the direct impact on the health service delivery systems, and then there are the secondary impacts. So let's start with the direct impact on the health systems. When the pandemic struck, naturally, we all moved in to prepare our health systems to respond to the pandemic. And that meant that, the workforce, the supplies, the equipment, and including even the leadership was all taken to focus more on responding to COVID-19. So that left reproductive health kind of unattended to, women lacking access to family planning, even just moving into for antenatal care, for postnatal care. So all the building blocks of the health system were focused on responding to the pandemic, leaving other health needs unattended to. And then secondly, the community, the population also feared, to get to health facilities because they thought that if they got there, then they could contract COVID-19. Right. So even where those health services remained available, you had people not coming in to access the services. And then we had also the government, putting in place measures to control the pandemic, which meant people could not move to access services. Health workers could not move to access communities. If you look at some of the areas where there are limited health services available, and health workers reach out using the outreach model. So even they couldn't move. Right. And then you have the second impact, the economic impact on women, women focusing more on unpaid care duty, like looking after children because the children are out of school. That exposed them to losing their jobs and income and leaving them more vulnerable. Children are out of school, and because they're out of school, the control system that come in with schools are not there. Then we have a rise in teenage pregnancies. Yeah. If
I may just jump in there, Doc, even though we understand that countries were prioritizing, obviously, the general physical well-being and health care of, its people, its countries due to this pandemic, we cannot, we can't ignore the fact that this negligence on sexual and reproductive health care had dire consequences on families, on communities, as well as countries. Take me through how those three categories at least were impacted.
Yes. So if you look at, like I did mention, that the health systems were taken to focus on attending to the well-being of the people from the pandemic. So you have women not being able to access, services, for example, family planning services. So that means they're no longer in control of when they would want to become pregnant. So if they became pregnant, when they are not prepared, then that left them at the risk of the negative outcomes of pregnancy. And also they found that, the health systems were, not available for them. And then down the line, as they move into deliveries, they can't access the necessary services to save them from the complications of pregnancy. You also see that, we have communities staying away from their places of work. That means less income for them, and some of less income, the less power, the less power to access health services. Even where health services are free, sometimes there are costs which are still borne by the communities. For example, transport to the health facility, So with losses of income, those minimal costs that people put in to access health services, meant that they could not get to.
I have to jump in there because we're running out of time, Doc, but with all this being said, in less than 30 seconds, if you may please be brief, what do you think governments then should consider? The pandemic is still going on in South Africa. We're experiencing a third wave currently. We're still grappling with this global pandemic, even in the continent. What should then governments consider to rectify this?
Yes, I think the first and most important thing is to ensure that, sexual and reproductive health services are considered as essential services, because again, we hear time and again that essential services must be maintained. The other second part is, we have to innovate on how we deliver services during this pandemic. For example, if you have lockdowns, how do you ensure that the commodities, for example, family planning commodities reach the people? We have commercial products, commercial delivery mechanisms ensuring that other essential supplies reach the people. So maybe we can ride along that. Yeah, then we can also focus on self-care, build the capacity of people to be able to look after themselves. And then lastly, we must really communicate the risk of not accessing essential services vis-a-vis the risk of, contracting COVID.
All right, Doc, we have to leave it there.
Make a balance.
Thank you so much for your input, Dr. Michael Ebele, United Nations Population Fund Advisor. Appreciate you talking to us, but also that point being noted, innovating how we deliver these priority and healthcare services. We'll be back with more at the top of the hour. You're watching the South African Morning.